Hello, everyone, and welcome to Grey Matter, your one stop to all your exam preparation needs. Welcome back to the series which focuses on the domains of UKMLA. Today, we are going to talk about the endocrine and the metabolic portion of the UKMLA exam. Now, as you can see that there are a bundle of topics given in the presentations and in the conditions part of the UKMLA roadmap. But fear not, this is just a mixed up or jumbled up portion that can be broken down into six particular topics. So the UKMLA consists of the six particular topics. If you can master these six particular topics, you can master the endocrine portion of the UKMLA and you can have the ability to conquer it without any trouble. So as you can see, all of these conditions, all of these presentations that are given, they can be summed up into these six topics, which includes hypothyroidism, hyperthyroidism, diabetes, pituitary adenoma, Addison's disease, and Cushing's disease. Now, if you can master all of these six topics, then all of these are a piece of cake for you. This is all just a different ways or different presentations how these conditions can present. For example, let's talk about the first topic, the amenorrhea part. So the amenorrhea, that is it can present as menstrual irregularities, but a cessation of menstruation that can be associated with hyper and hypothyroidism. Hyper plus hypothyroidism. And similarly, the bone pain can be associated with, it usually associates with hypercalcemia, and so it can occur as a result of hyperparathyroidism. So whenever the bone pain is considered, always consider increase in calcium. So that is associated with bone pain. And the part that is associated called confusion. Now, confusion can come in a number of ways. Uh, Most common way that the confusion occurs, it occurs as part of hypoglycemia. So when we read about confusion, we call hypoglycemia. Now, hypoglycemia, it can occur in two ways. One of the most important and favorable presentations of this condition, it occurs in the form of Simmons station, and that is a person comes to you with increase in alcohol intake and he has been binge drinking last night, and now he presents to you with confusion. So that confusion results due to hypoglycemia due to the increase in alcohol content level. So in this way, the confusion can occur. Now the next is decrease or loss of consciousness. That is the same way, the same thing. It can occur due to hypoglycemia. Electrolyte abnormalities, any abnormality in hypocalcemia, most likely it occurs as hypokalemia and hyperkalemia. Hypo plus hyperkalemia. Now, an interesting one, the Addison's disease, was the erectile dysfunction, sorry. The erectile dysfunction, this occurs as a combination of symptoms that are present in the pituitary adenoma. Now, the pituitary adenoma is a very, very important topic nowadays. Nowadays, the UKMLA, the GMC, it is one of the favorable topics of the GMC. It occurs as a number of symptoms such as headaches, visual problems, weight gain, menstrual irregularities, erectile dysfunction. So we can talk about fatigue. Fatigue can come in a number of ways. It can occur in hypothyroidism. It can occur in diabetes. So a number of things. This is one of the very vague symptoms. It usually occurs as in addition to some other symptoms. Gradual change or loss of vision, that can occur in diabetes as well as hypothyroidism and pituitary adenoma, as we have just discussed. Now, gynecomastia. Now, gynecomastia, that is a very important disease, and gynecomastia, it occurs also as a result of the endocrinal problems, and it can associate with thyrotoxicosis. Now, what is thyrotoxicosis? It is one of the complication of hyperthyroidism, and increase in LH, luteinizing hormone. It results in LH, and it can present with exophthalmos. So these symptoms together can present as gynecomastia, which occurs in thyroid toxicosis. So as you can see, as I told you, that most of these symptoms, they are collectively present in the six diseases, that if you conquer those six diseases, you can easily conquer all of these topics. Hoarseness and voice change, that is also present in thyroid problems. Hypertension, that is itself, it can be an essential hypertension in which there is no definitive cause of hypertension, or a secondary hypertension that can occur due to any problems associated with and your thyroid, your adrenal gland, your kidneys, so any of the other organs. Now, menstrual problems we have already discussed. Menstrual problems can occur as part of the thyroid problems or as part of the pituitary adenoma. So as a pituitary gland, it regulates the menstruation part of the body, and so any problem with the pituitary gland, it can occur, it can cause the menstrual problems. So whenever such cases occur, always think of pituitary gland. Nausea, it is also again a very vague topic. It can occur with all of the diseases that we have discussed. Neck lump, thyroid problem, always think of thyroid. Now, nipple discharge, it can occur due to hypothyroidism or pituitary adenoma. So hypothyroidism plus pituitary adenoma. Palpitations, that can occur due to the hyperthyroidism. And polydipsia, it is a classic presentation of diabetes. And pubertal developments or problems can occur due to pituitary adenomas. Urinary symptoms, again, classic presentations in the diabetes cases. Weight gain and weight loss. Now, this is due to the thyroid problems. It can occur. Weight gain. Now, weight gain is associated with hypothyroidism. Now, one of the ways to remember it is hypo. In case of hypothyroidism, hypo means less. So there is more accumulation of the bodily contents inside the body. You retain the products, you do not evacuate the products. So as there is constipation, you're not evacuating your bowel, so that will result in increase in weight. So this is some mnemonic or a trick how you can differentiate hypo from hyperthyroidism. Weight loss is associated with hyperthyroidism if we are talking about the metabolic causes, but weight loss is one of the classic presentations of any cancer. So it occurs as part of any cancer. Whenever weight loss comes, always think of cancer first. Now, the conditions that we are going to talk about, Addison's disease, it is one of the very important topics that you need to learn. It is associated with darkened skin, dehydration, fatigue, and unintentional weight loss and salt craving. So it can present as a patient who is always craving salt, or a child who has presented, mother is saying that, here doctor, he's always licking his skin, because there's salt on the skin and he's always licking his skin. So always think of Addison's disease. Cushing syndrome, again, weight gain, round face, a buffalo hum, the purple stria. Diabetes in pregnancy, diabetes insipidus, this is all associated with diabetes. Diabetes insipidus, there will be a pale urine, there will be weight loss, vomiting, fever. In case of diabetes insipidus, remember to order the water deprivation test. Now, diabetes mellitus type 1, type 2. Type 1 is insulin sensitive, type 2 is insulin resistant, and polydipsia, polyphagia, they are associated with all of these things. And diabetes ketoacidosis, this is one of the complications of diabetes. The glucose level, it raises to an alarming level, and that results in a lot of major complications, can result in death of the patient. And one of the causes is infection, and another cause can be dehydration. Diabetic nephropathy, complication of diabetes, the kidney function would be deranged. Diabetic neuropathy, it can be associated with tingling sensation or loss of sensation in the distal parts of the body. Essential secondary hypertension, we have discussed. Hypercalcemia malignancy. Now, we have discussed that bone pain can arise due to hypercalcemia. Now, in case of hypercalcemia malignancy, some malignancies, especially metabolic malignancies, they result in increase in calcium level in the body. So that is called hypercalcemia malignancy. So in case of malignancy, fever would be present, some weight loss would be present, loss of appetite would be present, in addition with increase in calcium levels. Hyperlipidemia is simply increase in the lipid levels of the body, and that can result in numerous diseases such as the peripheral vascular disease. It can result in atherosclerosis, your MI, your stroke. Hyper or smaller hyperglycemic state, again it is the one of the complications of diabetes, most likely the type 2 diabetes, and it results in severe hyperglycemia and extreme dehydration. Now, hyperparathyroidism. Hyperparathyroidism is increase in parathyroid hormone, which results in increase in calcium level. So extreme bone pain will be present, moans, groans. Remember the mnemonic from the PLAB. And hyperthermia and hypothermia. Now, hyperthermia and hypothermia is simply fever. Hypothermia is usually not important. So remember, hypothermia is fever, it is one of the symptoms. Hypoglycemia, we have discussed. Hypoparathyroidism, we have discussed. Hypothyroidism, we have discussed. Obesity. Now, obesity can come in number of ways. It can come as a result of different conditions such as Cushing syndrome, or it can result due to weight gain called hypothyroidism, or it can be due to any sedentary lifestyle. Osteomalacia, now that is the again a weakening of the bone, inadequate mineralization of the bone. To be specific, there will be decrease in vitamin D levels, calcium levels, and phosphate levels. Osteoporosis, again, this is not really important, but you should know that it is a weakening of the bones. Mostly it presents in females and in normal adults. Peripheral vascular disease, we have discussed. This is also not an important metabolic disease, but it can occur in surgical cases. And whereas there is pain in the vessels supplying the limbs, lower limbs most precisely, and it can be relieved by walking, or it can occur at rest, which indicates the higher level of the disease. And finally, the pituitary adenomas, which are included in the pituitary tumors, and we have discussed it associated with headaches, visual problems, weight gain, menstrual irregularities, and erectile dysfunction. So there you go. These are the different topics of the endocrine system. Now remember to subscribe, like, and share these videos.